when you're working in that complex chronic model, our expectation is that we're going to see shifts to those things as treatment progresses, right? So
Absolutely.
my example is on being on the IV side of things. What my thing was, I could tell when I'm starting IVs on folks, I could tell your Bartonella patients who were early in their treatment, right? Because they've got all that peripheral hypersensitivity. The needle is, or the cath is uncomfortable the whole time. And then we could see over the weeks and the months as they were treating, a calming down of those symptoms. And so I imagine, especially for you, those physicals and being able to track those symptoms that patients aren't necessarily reporting.
And I really have been trying my best to encourage patients to really journal, which I'll have to talk about more sometime because a lot of the complex chronic world, there aren't really a lot of quick fixes for things. I mean, it's really nice when we get really big wins and stuff moves quickly, but that's the exception, not the rule, I guess I would say. And so you need to be able to objectively monitor these things too as a practitioner. But I'm also really wanting to encourage patients to journal their symptoms because they may have gradual but significant changes over time. They may not remember all the time that the catheter was more sensitive. Uh, Maybe they'll have a recognition of it eventually. Oh yeah, just woke up someday.
A lot of times they don't. And I'll be
Yeah,
the one talking to them about it, right? I'll be like, oh, look, you tolerated that a lot better today. Or they'll kind of, oh, I guess, or right. So yeah,
totally.
interesting.
Yeah,
And I
so
love
the
that.
awareness piece and the mindfulness is really important too, and
Yeah,
it also helps us as practitioners. So,
yeah,
and it's not
yeah.
their fault, a lot of times it's just there's so many symptoms that wax and wane on a daily basis. There's brain fog,
Oh,
the nervous system sensitivities or pain sensitization and all kinds of things that are kind of going into this. So it's like I said to people, it's different degrees of feeling bad sometimes. So, but
yeah,
it's easy to forget some of these small progresses. So yeah, we'll
yeah,
talk about that again
absolutely.
sometime.
Yeah, I love that.